Hello. I'd like to welcome everyone back to Battelle, back to your old stomping grounds. I'm Melissa Littoral. I'm the Vice President of Benefits for Battelle. So we have a lot to cover in a relatively short period of time, so we'll jump right in. So I've talked to a number of you already, a number of retirees also about this change, and it's clear that there is some trepidation about what we're going to be going through. So we wanted to alleviate some of that anxiety, to kind of talk about the transition and this change to the new way we're going to provide retiree benefits, and to also address kind of why we're making this change. We want to talk through some examples of the impacts to retirees, and we want to introduce a representative from Extend Health, so you can hear directly from the group who's going to be helping you transition from the Battelle group plan to an individual plan, as well as work with you throughout the rest of your lifetime related to your retiree health benefits. Then we're going to stop and we're going to answer questions and collect the cards that are on the table and try to address any final concerns. So now a Battelle retiree with the Battelle plan really has it somewhat easy in a sense. You don't have to go through all the advertisements that are in the mailbox for the hundreds of plans that are and offerings that are out there. You don't have to think about how to pay the bill. It comes out of your pension check, generally speaking. But on the other hand, you really don't have a choice. So there may be plans that arrive in your mailbox that are better for you, but because of the complexity of the whole thing, you don't know. I can understand why you wouldn't want to tackle that. However, over the last several years, the Medicare individual care market has really improved significantly. I mean, first there was the addition of pharmacy benefits, but there's also something that probably most of us aren't aware of. I'm aware of it because I'm the administrator of the Battelle plan, is that those insurance companies get discounts and subsidies that our plan will never receive. That allows them to provide benefits at a higher level, better benefits at a lower cost than Battelle could ever provide under the current circumstances. So we've been hearing about this group, Extend Health, for a couple of years from other Department of Energy laboratories around the country, from one of our own labs in Oak Ridge. And we've been talking to the other labs, we've been talking to the retirees from the other labs, and hearing about this great product and how wonderful it is. And frankly, we were more than a little skeptical. It just sounded too good to be true. So we did our research because we keep hearing this positive feedback. And here we are. Based on our research, we have found that it's true. And so we wanted to offer this to our retirees and allow them to have the opportunity that we're seeing for the other contractor labs of the Department of Energy. So most of you have already received the packet of information describing the changes, but just as a review, as you see here on the slides, the Medicare complement plan is going away on December 31st of this year. The retiree medical coverage will be continuing through Extend Health. Battelle will provide eligible retirees with an allocation to a health reimbursement account, or an HRA. And that HRA account can be used to help defray the expenses for the retiree medical plan premiums and for the prescription drug plan premiums. In addition, it can be used for coinsurance and copays for the medical and prescription drugs. Battelle will continue to offer the retiree dental plan, but you can also choose, or as an alternative, you can choose the dental plan that is available through Extend Health. Battelle does not offer a vision plan, but Extend Health will offer a vision plan, and you can choose a vision plan through Extend Health. The way that you pay for your retiree medical premiums will also change. Currently, to the extent the check is sufficient, retiree medical and dental premiums are withheld from a retiree's pension check. If the check is not sufficient, then the retiree will pay Battelle's direct billing service, which is PayFlex. Under this new program, retirees will pay the insurance company directly. Then the retiree will submit a claim and receive a reimbursement from the health reimbursement account. An allocation is going to be made to the account for retirees who are eligible, and an allocation will also be made for an eligible retiree spouse. The account is a joint account which can be used by either or both of you. The allocations, again, can be used for premiums for the medical and prescription drug plans that are elected through Extend Health. They can also be used to help pay for medical and prescription drug co-pays and co-insurance. But they cannot be used for Part B premiums. The amount allocated to the health reimbursement account was calculated based on putting retirees, the most retirees, in an equal or better position to the plan that Battelle currently sponsors. So we looked at a retiree's total out-of-pocket costs. That includes premiums, co-pays, and co-insurance under the Battelle plan, and then we compared that to what the cost would be under a comparable Medicare plan. So our change is expected to result in the same or better overall out-of-pocket costs for the retirees as is experienced currently under the Battelle plan. I'm sure there are a few of you in the audience who are not yet eligible for Medicare or whose spouses are not yet eligible for Medicare. Those who are not eligible for the Medicare plan will remain in the Battelle plan and the retiree dental plan if they participate in that plan until they become eligible for Medicare plan. Then as long as this retiree has kept the eligibility and the spouse has remained eligible, they will then be enrolled in coverage through Extend Health. They will be eligible for the HRA allocation at that time, and then their participation under the Extend Health coverage will begin. So we believe this approach will allow you to have choice, support for making your decision among all of the options for the Medicare plans, and will result potentially in savings for you and for Battelle. You could choose a plan that costs more, but you can choose a plan that costs less. So that's where you're working with Extend Health is very important. But why did Battelle choose Extend Health? Extend Health is an industry leader. They're the largest and most experienced firm in this business. We performed a competitive bid process, and Extend Health came out on top both in service and quality. They had excellent references. As we previously indicated, a number of Battelle's comparators, competitors, and other DOE labs have already gone with Extend Health, and they and their retirees have had very positive experiences. Extend Health also has the people and the tools that will make this transition easier. Their benefit advisors must be licensed in the state in which a retiree resides, and in addition, they are trained extensively by Extend Health. Then after the transition, they will stay with you and offer lifelong and ongoing support. So again, coverage under the Battelle plan ends on December 31st, 2012. You will select and enroll in a plan before December 31st, 2012. If there are some folks who are under what's called the opt-out, they made a decision at the time to move to a Medicare Advantage plan already. We have about 50 folks, not a whole lot, but just be aware if you're one of those people that your election date is December 7th instead of December 31st. There will be a separate enrollment for the retiree, a separate enrollment for the spouse, and a separate enrollment for any dependents that are eligible for Medicare. So what you pay will now depend on the plan you select. You will enroll through Extend Health instead of with Battelle, and you will go to Extend Health with your ongoing questions regarding your medical coverage. So what you will need to do is call Extend Health, learn about your options, ask your questions. Then you'll schedule an appointment with a benefit advisor to complete your enrollment. You'll choose your plan, You could choose a plan for yourself. You could choose the same or a different plan for your spouse, and again, any dependents that are eligible for Medicare. So now I'd like to introduce Colin McLennan from Extend Health, who will come up and talk to you directly.
Again, good morning, everyone. My name is Colin McLennan. I am a benefit advisor from Extend Health in Salt Lake City, Utah. I came out here the other day to walk the retirees through what's happening with your 2013 health care coverage. Again, it's my 4th year at Extend Health. Prior to that, I spent 4 long years in the U.S. Navy, but I'm happy to be here. Don't leave today if you have questions or concerns about what's going on with your coverage, or you have a personal situation you want to talk to me about. We've got a lot of time after this to sit down, so don't be shy. Who is Extend Health? We are the nation's largest Medicare exchange. And what that means is that we've partnered with over 80 different nationally and regionally recognized insurance carriers. Okay. We've brought all of their individual Medicare products to one single place that retirees can choose those products from. What my company does is we pair you, the retiree, with a benefit advisor like myself. We evaluate what's important to you in a healthcare policy, and ultimately we help you enroll in that new plan. These folks that you're going to talk to, myself included, are all U.S.-based benefit advisors. Okay, it says that they're objective and trusted. It's just a different wording for we are salaried benefit advisors. So when we're talking to you about plan options, when we're discussing Humana plans or AARP plans or Blue Cross Blue Shield plans, we don't get offered extra money offering one plan over another. Our job is to help you enroll in the plan that best meets your individual needs. If you spend any time researching Medicare, you can tell pretty quickly that it gets confusing. There are numbers to memorize, whatever it might be. So it doesn't matter how many times you call Extend Health or how many questions you have. The service is free of cost to you. Okay, so don't hesitate to phone us, to ask us questions, and get a better understanding of what's going on and what Medicare does and doesn't do. That's our job. This is not our first time helping retirees find individual plans. So in 2006, we cut our teeth on essentially the big 3 automakers, Chrysler, Ford, and GM. That's when we began this process of helping retirees find individual plans, was 2006. Anyone want to take a guess at how many retirees GM has? Okay, 100,000. By the time that we're done helping retirees enroll this year, we will have helped over 500,000 retirees with this process. Okay, so over the years, we've learned 500,000 individual lessons about how to do this correctly. Okay, so when we've had a lot of practice. Some of the clients that we've done this for previously include Caterpillar, Union Pacific, Sandia National Laboratories, Lawrence Livermore, the state of Nevada. So those 500,000 people are coming from some of the largest private and public sector companies and entities in this country. They are companies that trusted Extend Health with their retirees, just like Battelle is doing today.